My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
My name is Sara. I've got rapidly diagnosed with ulcerative colitis in 2014. I do believe I do have some Crohn's symptoms, so I think I fall more in that indeterminate spectrum. I have a permanent ostomy with a Barbie butt, and I kind of went that route instead of the J pouch because I do feel that it is somewhat Crohn's. And I do advocacy work, particularly around medical cannabis and pediatric Crohn's and being able to take it to schools. So good luck on that. But
Yeah.
so that's kind of where I stand with a lot of that. But my question, and being someone who ended up with an ostomy, who tried absolutely everything to make my disease stop, does a specialized diet help reduce symptoms of inflammatory bowel disease?
Yeah, it's a wonderful question, Sarah. It's a really hot button topic. You can imagine. Gastroenterologists believe that really the essence of inflammatory bowel disease is you have environmental and genetic factors that, for some reason, cause our colons to mount an exaggerated immune response against normal gut bacteria that normally we shouldn't mount a response to. And that inflammation can eat away at the colon and cause all the complications of Crohn's disease and ulcerative colitis. So there's been a lot of research in terms of understanding what we call the gut microbiome, which is basically studying all the different types of bacteria and their quantities in the colon and how they influence the colon and colon health. And you can't talk about the microbiome without talking about all of the nutrients that we consume that feed that microbiome and can potentially alter it as well. You know, our gut microbiome in this Western diet is very, very different from, say, hunter-gatherer communities in Africa, for example. And in that community, IBD is basically foreign. IBD really is a disease of industrialization. You see that countries, as they become more industrialized, as they adopt a more Western diet, the incidence of inflammatory bowel disease goes up. Whereas it was previously foreign, now people are getting it. And there are wonderful maps out there that you can get following industrialized countries like industrializing countries like Pakistan, India, etc. No one really heard of IBD, and then McDonald's started opening up, and then a slew of people are starting to get it. So that just kind of belies the whole point of diet is important, but unfortunately we don't really understand exactly how it is. We know it is important, but we don't really understand how. There are a lot of proposed diets out there, from gluten-free diets to specific carbohydrate diets, to kind of autoimmune diets, paleo diets. Diet is a really, really difficult thing to study, particularly in adults. One, because we all cheat consciously, but also the foods that we eat aren't necessarily exactly what we think they are. There can be hidden things in the label, or things that are not on the label, that kind of pollute the diet, so to speak, and mess up the findings of the study. And in addition to that, diet may affect different people, even with Crohn's disease or even with ulcerative colitis, in very different ways. Crohn's disease has many different flavors from a genetic standpoint. And we've kind of, when we initially characterized disease, we just called everything Crohn's disease. But it's from a genetic standpoint, we realize that it's actually a very, very heterogeneous disease. There are many different types of diseases. And so when you're doing a diet study, are you choosing the right people? Are you just choosing any old person with Crohn's, or are you specifically focusing on ill Crohn's or whatnot? That's basically the point I'm getting at. So the diet studies are really few and far between, and they're very small. They tend to be, and they haven't really reliably shown us that one diet is better than the other. I'll give you some examples. Okay, so gluten-free diet. A lot of patients come to me and they say, Doc, I've heard about gluten-free diet in patients with IBD. Can this help? Studies have shown that up to 2/3 of patients can clinically improve, meaning that their symptoms have improved. But nobody has shown that the underlying inflammation in the colon has improved. Um, and with inflammatory bowel disease, it's important, obviously, to treat symptoms. We want our patients to feel better. But it's also important to treat the underlying inflammation that's going on in the colon, because that inflammation is what's causing damage in the long term. And that's what's increasing the risk of things like colon cancer. Unfortunately, symptoms and inflammation, they really don't correlate well together. And this is the crux of a lot of questions that y'all might have. So it's almost like a 50-50 mix, to be honest. I've seen patients come up to me, have absolutely no symptoms. We do a regular colonoscopy, and there's a ton of inflammation all throughout the colon, and you're just like shocked that patient has no abdominal pain. And then you see the complete opposite. A patient comes in, they're reeling over in pain. Sometimes they have to be admitted. And you do a colonoscopy and it's absolutely pristine. And you wonder what the heck's going on. So just because you have symptoms doesn't mean that you have a lot of inflammation going on in your colon, but it does mean obviously that you need to see a provider to get that treated. So I'm digressing a little bit. Okay, so back to gluten-free diet. So gluten-free diet, there was one study at least that showed up to 2/3 of patients had symptom improvement, but nobody's really shown that the inflammation has improved. Likely, my feeling is that gluten-free diets probably benefit a subset of IBD patients, patients who maybe have celiac disease, because that's kind of what the gluten-free diet's for. Maybe patients with irritable bowel syndrome as well, because it's a diet that's low in sugars that typically produce a lot of gas that can exacerbate irritable bowel syndrome related pain. It may help patients with IBD who also have small intestinal bacterial overgrowth. That's kind of my feeling. Then there's a lot of talk about specific carbohydrate diet. This is a really difficult diet because you eliminate basically like most of the good tasting American diet foods. So it's a diet that eliminates most carbs, particularly simple sugars, eliminates grains, a lot of starches, most dairy, processed foods. And the idea is with the specific carbohydrate diet is you're consuming carbohydrates that are more easily digestible. And the theory is that with IBD, there's some degree of malabsorption going on, so your body can't absorb some of those sugars. So if you eat simple, more easily digestible carbohydrates, this will help feed the gut and this will be more easily absorbed. Randomized controlled trials are really ongoing. It's not really currently strongly recommended because there's just a lack of studies involved, and there's a lack of evidence that it leads to, again, that reduction of inflammation in the colon. There's also things like the autoimmune diet, paleo diet. The autoimmune diet has some kind of initial data that shows promise that it improves symptoms. But really the large studies are lacking there. So really the bottom line is I think it's important that at least once during any patient's course with IBD that they meet with a dietitian to chat about what strategies one can use to kind of monitor their food intake and to monitor what foods make their symptoms worse and what don't. And in general, I just tell my patients that the typical Western diet has a lot of pitfalls. And if you can avoid processed foods, particularly foods that contain a lot of simple sugars, the preservatives, those kind of harmful emulsifiers, then the better you're going to be. Also, you should eat a well-balanced diet, particularly high in fiber in the form of fruits and vegetables, low in animal fats, dairy, again, as unprocessed as you can get it. That tends to be kind of my only general recommendation because that's just a healthy diet in general, right? But again, very good question, a very complicated question. It's an active area of research. It's very difficult to do research on it. So I think it's reasonable every year if you see your gastroenterologist, just ask them, hey doc, is there anything new on the diet front that I should be aware of?